Hello everybody, this is Namrata from Clinic Spots, and today we have one of the most experienced and a talented medical oncologist, Dr. Uma Dangi, who has priorly worked with Tata Memorial Hospital and currently associated with Fortis Hospital. Hello doctor. So till now, you have provided a lot of information regarding the cancer. We are very helpful for that. Still, I have two more questions for you. There are some advanced treatment named as immunotherapy and targeted therapy. So I will like to know something about these two therapies.
Thank you. So the science of cancer is advancing rapidly, and we are learning more and more about why cancer is occurring. So we are trying to decipher the molecular biology of cancer, and during this research we have come across things like we know that there are certain mutations which are specific for a particular cancer and which is driving that particular cancer. So targeted therapy is something that we are trying to which targets this particular mutation itself and tries to control the cancer. So for example, in lung cancer, we look at EGFR mutations, we look at ALK, we look at ROS, which helps us decide whether a particular targeted therapy is suitable for this particular patient. Even in breast cancer, when we are looking at ER, PR and HER2, we are looking at targets basically which we can use for using specific drugs for that particular cancer. So, but there is a myth that targeted therapy is not without side effects. Although the side effect profile is slightly different and they are milder than chemotherapy, but there certainly are side effects. So targeted therapy is nothing but trying to target a particular driving mutation in that particular cancer to get the best possible result. Coming to your second question about what is immunotherapy, everybody will have immunity, and like I have said earlier in my talk that cancer is nothing but developing mutations in the cells. Now when these cells become abnormal in a normal human being, they are detected by the T cells, by their own immune cells, and these immune cells are able to get rid of these mutated cells and keep the patient healthy. After a while, these cells will acquire certain additional mutations and escape the immune system of the body and develop into cancerous growths. What immunotherapy does is nothing but stimulates the body's own immunity or immune cells to attack the cancer. So if initially the immune cells could not recognize cancer cells, now they can with the availability of newer drugs which are available here now. It is not just drugs. There are drugs which we call as PD-L1 inhibitors and PD-1 blockers, which we use for as immunotherapy. In addition, there are other ways to use immunotherapy like vaccines. There are something called as T-cell transfers, where the patient's own T cells are removed, cultured and given back after being genetically engineered to kill the cancerous cells. So there are various ways in which immunotherapy can be used. But again, there are side effects to immunotherapy. It is not without side effects. When you stimulate the body's own immune system, it will attack the cancer cells, yes, but there is a risk that it will affect the normal organs of the body as well. And this may lead to side effects like developing thyroiditis or colitis or any inflammation anywhere in the body or interstitial pneumonitis. These side effects are by far minimal and manageable with steroids and other treatment.
Thank you doctor for your information. This video will be very useful for the people who wants this information regarding this therapy. Thank you so much.
It's a pleasure.